Hello, everyone. My name is Clemens Martin Auer, and as you might know, I am the president of the European Health Forum, and therefore it's my pleasure that I am able to extend to all of you a very warm welcome in the name of the board of the European Health Forum, in the name of our executive director, Dorle Gottlieb, and her staff. Welcome to Bad Hofgastein. Thank you for coming to this beautiful valley, and thank you also for joining us online. We are operating this conference in a hybrid format, so we have surplus our visitors here in Bad Hofgastein. The number of participants is up to the pre-COVID times, but virtually we are also creating a new Gastein crowd over the web, so altogether we have at least 1,500 participants, and you're all very welcome. Dear friends, do you remember the last few titles of our conferences here in the European Health Forums? We were dancing with elephants, as you remember. We were rising like a phoenix. We were bold and brave, and so on. Yes, so we were all very optimistic. COVID and the circumstances around it propelled health in the center of the national, European, and global political arena. Health politics became important, very sexy. Even head of states talked about it. Solemn oaths, I remember that very well, were sworn. Never again do we want to be unprepared when the next global crisis hits in our face. So the catchwords were resilience, trust, innovation, investment, very, very exciting phrases. I believe the situation has drastically changed. And I don't want to sound like a Cassandra or a doomsday prophet, but after the many shock waves we had to endure in the last 15 years, you know, the financial crisis, economic crisis, increasingly the climate and the environmental crisis, and of course COVID. Now we also are faced with a war in Ukraine and high inflation with all the negative aspects for the societies. Our conclusion here is the shock waves lead to chronic fatigue in the system, foremost in the health workforce. The fatigue of our health workforce is the most challenging threat in the moment. My British friends, I excuse myself if I say so, but the UK is in the moment the negative example of practice, so to say. Health workers on strike, not only in the UK, but in many other places, but very prominently in the UK. Can you imagine health workers on strike? If that happens, something fundamentally must be broken. Fundamentally must be broken. And I'm not alone with my analysis. OECD said recently, underprepared, understaffed, and suffering from underinvestment. A damning indictment of the state of our health systems. That's OECD. It's not even Clemens Auer, it's OECD. So with all the progress we made in the last decades, and undoubtedly we can be very proud of it. Medical science and systems-wise, we achieved a lot. We can be very proud. But the health systems now are in a challenging condition. And don't be misled by all the optimism we still can have. The quality of healthcare is going down. And the quality of healthcare is already getting affected. Patients, and that's the most important thing, patients start to recognize the downward path. So the focus of this conference is how to counterbalance these shockwaves and fatigue. In the end, it is about how to keep, in the sake of the patients, these threats away and to save the health systems. So the questions are on the table. what are the most urgent and prioritized policy measures we need. What should be the next mandate for the European Health Union? What should be put on this health agenda after 2024, after the European elections? Or next year, we also will have elections in for the new regional, old probably, regional director of WHO Europe. But it's also the next work plan, 2025 onwards for WHO Europe. How can we better train, retrain, and it's important to show how can we retain the health workforce in the system? What policy measures can stop the shortages of essential medicines and molecules? What kind of technology and innovations are the proper and timely answers to help counterbalancing the shock waves and fatigues? And very, very important, and this is very close to my personal heart, how can we safeguard our solidarity systems? The magnitude of new responsibilities of our governments when it comes to climate, greening, picking up the bill for natural catastrophes is immense. So there's a lot of competition for the solidarity system when it comes to financing governmental functions in modern states and in modern welfare states. So I hope this conference we can give at least some answers. I'm very happy that the Commissioner, Stella Kyriakides, is with us. I'm also very happy that the Regional Director of WHO, Hans Kluge, is with us. Thank you, the DG for Santé, Sandra, that you are here. Very welcome. The highest ranking health official globally is among us, Chris Fern, the President of the World Health Assembly, Deputy Prime Minister in Malta, and Chris, I think you are the longest serving health minister within the European Union. I don't know how you'd made that. I'm very happy that the Minister of Health of Austria, Johannes Rauch, a dear friend of the forum, is here. Experts from Israel and the Baltic countries, our friends from the Western Balkans are here. The finest academicians helping us to understand the world, Professor Ilona Kickbush and Martin McKee, to name just two. Our dear partners from the observatory, what would we be without you guys? The young Gasteiners, welcome. We are heavily relying on your preparedness for a better future. You have to pick up the pieces we are leaving you behind. And we have really promising and good representatives of young professional organizations which will help us to understand the crises that we are in, especially facing the health workforce. Friends, again, I don't want to sound like a doomsday prophet here. I just want to send a wake-up call here. But I have to call for urgent actions. We need quick fixes and precise policy measures. We don't have time to change the treaties when it comes to the European Union or our national constitutions. These are endeavors we don't have time for. And be very clear. If we fail, more is at stake than just health systems. Weaknesses in the public health systems lead to social inequalities. And social inequalities lead to undermine and underfunded solidarity systems. And if solidarity systems are failing, we are endangering nothing more than the freedom in our societies. Be very clear about it. And the health systems are in the center of the solidarity system. Of course, good pension systems and unemployment insurance, everything is important. But the broad population is relying on strong solidarity systems for public health systems. And if they are failing, we are losing a lot. All this, the failing, would be water on the mills of the populists. We know them, they're all around, of nativists, very bad things, right or left-wing radical nuts, we all observe them with big concern. Or another aspect, when public health systems fail, the private sector will fill in the gap, of course, because that's business. And you might say, okay, better than nothing. The private sector should take it over. But if you treasure, like I do, solidarity systems, you should be worried that the private sector might take over the health systems. Because private health systems are not the solution, they are creating new problems. By the way, in Austria, and my minister knows that very, very well, the fastest growing sector in healthcare, the fastest growing sector in healthcare is the private outpatient service sector. And this is a very, very negative development. So please, let us consider solutions, team up in action, government representatives, our friends from the Commission and WHO, our friends in social insurances, the health workforce representatives, civil society, and academia. Please team up to find good solutions. We have one last chance. Let's do it now. Otherwise, we will wake up one morning in a very, very difficult and different political world we all don't want to experience. On this note, please have a wonderful conference, be optimistic and strong, and find the solutions. Now it's my pleasure to introduce you to our dear Commissioner, Stella Kyriakides, which is with us, at least online. Thank you, Commissioner, for being with us, being always supportive of the European Health Forum. And I'm sure you have some good advice and solutions how to counterbalance the shock waves and fatigue in our systems. Very welcome.
Thank you so much. Thank you, dear Clemens, dear Hans, dear Johannes. Thank you for the opportunity to be here. And Clemens, yes, I can confirm that Chris Fern, who is there, our health minister and deputy prime minister for Malta, is the longest standing minister in the Health Council. So you're absolutely correct, which shows a great deal of resilience. Thank you, Clemens, for beginning with some statements that many of us have tended not to remember as time passed, about the solemn oaths taken, the way health has been propelled into the top of political agendas because of the pandemic, and the importance of having strong health systems, which need to really be, as you said, the core of a resilient society, because it is a society and an economy that cares and delivers for its citizens that we need to be working towards. And a resilient health system is what is needed to be at the very center of an effective response to a health crisis. And these health systems, they must be sustainable, they must be affordable, and they must be accessible to all. And this was never more evident than in the first early days, I would say, of the pandemic. And this pandemic is a constant reminder for all of us, no matter where we are, what we represent in the institutions, in the European Commission, that there is still much more that we should do, both within our health systems in Europe and between our health systems at European level. Over the past years, we are taking concrete steps to shape the health systems of the future and to secure the foundations of what we have come to know as a strong European health union. And you're absolutely right that building a strong European health union that would bring health to the heart and reach every European citizen and deal with inequity, there was and there is no need to change the treaty to achieve that. And we have made concrete steps that I want to share with you today. You've mentioned the crisis that we have been dealing with over the last few years. pandemic and following the pandemic. And I would just want to touch on Russia's invasion of Ukraine, because this has also shown us how important it is to have health systems that can withstand pressure and that can deliver in very challenging circumstances. And you also need health systems that can deliver in a very tangible solidarity. And this is an example that we saw in Europe, where Europe opened its doors to over 10,000 Ukrainian patients in a few days after the war started. And much like the early days of COVID, when we saw Europe at its best with doctors and nurses treating patients across European borders and helping their colleagues that were under incredible pressure across the Union. And it is this solidarity that we need to continue to have uppermost, solidarity and collaboration, but also to bring about change. We have further stresses now, which are caused by climate change. We have an ever-evolving health security landscape. And this shows us the importance of having this common sense of purpose. And this is what a European health union is about. It is doing more for our citizens' health, where we can work together. And this forum, the European Health Forum Gastein, has always been a critical forum for these discussions in healthcare, bringing different viewpoints together, hearing criticism, seeing the positive, and building for the future. So I really am very, very pleased to be able to join you, even though virtually today. Health is much more about economics as it is about care. You need to have both. And resilience in healthcare is an investment in our future. And funding for this is key. And this is why over the last 4 years, we have made unprecedented European funding available to our member states. Our Recovery and Resilience Facility is about building the strength of health systems across the Union. And I just wanted to say that over 43 billion euro has been earmarked for health investments and reforms in the 27 national recovery and resilience plans. And the biggest ever health funding program, EU for Health, is investing in the vital components of effective health systems, in facilities, in supplies, and in staff. Since 2021, close to 56 million euro have already been dedicated through EU for Health for this purpose. We also saw with COVID the importance of digitalization in the area of health. Digital health can empower patients to improve integration across primary care, across hospital care, and long-term care. And we can have digital health solutions in all care settings, because this will ultimately improve accessibility, improve effectiveness, and improve resilience. And who can forget the COVID vaccine certificate, that in 3 months we were all able to have access to this in a digital way, and which opened up our economies and opened up our society. So we saw what we can do through digitalization. And we're now moving as one of our pillars of the European Health Union with our world pioneering European health data space that is going to make better use of the potential of digitalization, because ultimately, as was mentioned at the beginning by Clemens, what we need to do is to have better treatment for patients. We need to have a trained health workforce. We need to also have suitable numbers with the right skills, and digital is one of these pillars. On the trained health workforce, which is crucial for a strong health system, we are at present funding 7 projects that will deliver training programs for health professionals focusing on digital skills. But in addition to funding, this can not only be about funding, reforms are needed. And these we have put already in motion in the European Health Union. We have a stronger expert health security and medicines agency in EMA, in ECDC. We have established a new health emergency preparedness and response authority, HERA, to ensure that we are better prepared to face health threats in the future. And we have one of the world's now most ambitious and well-funded cancer plans, which is already delivering tangible changes for patients and their families across the EU. Through this plan, we are now building the first ever EU network of national comprehensive cancer centers to boost collaboration among oncology professionals, but ultimately to reduce inequalities that we see across the EU in cancer care. And this will ultimately revolutionize the way we tackle cancer in the EU. And as some of you may know, we also put forward, after 19 years, a reform of the EU pharmaceutical legislation, because for us, affordability, access, and availability of medicines is essential for every citizen in the EU. And we have managed to have, through the EU and through our legislation, safe and effective medicines. But what we have not managed to do is have a single market for medicines. And this is what we're aiming to do through the reform, so that every citizen, no matter where they live in the EU, every patient has access to the medicines they need when they need them. So, dear friends, it's our task that we ensure that health remains at the very top of the political agenda, that those resounding loud statements that we heard, which propelled health, the oaths, the solemn oaths taken, that we do not think that this is statements said and they're over. We need to keep health at the top of the political agenda. We have set reforms and put reforms in motion. We have shown that we can make a difference with our member states, within the member states, and across the member states in a European health union that is truly European. And we base our efforts on solidarity, equity, and collaboration. We need to all work together with industry, with health workers, with civil society. And because I've spoken a great deal about the European Health Union, and because I know that a dear friend and colleague that I've worked for over the last 4 years very closely, Hans Kluge, we cannot work without working out of our borders. We need to work, and we do work with WHO. We need to work with everyone involved in the area of health globally, because ultimately many of the problems and challenges we're facing are global. And this is about collaboration. This is about solidarity. And this is about having the ambition to work towards these important goals. And Clemens, I am by nature an optimist. And if I look back and see what has been achieved within the European Union in the area of health over the last 3 years, I feel that we are moving forward. But there is definitely more we can do, and definitely this is a pace that we cannot, none of us can afford to slow down. Thank you very much for giving me the opportunity to be here, and I look forward to hearing the next interventions. Thank you.
Thank you, dear Stella, for your frank words. And our second multilateral collaborating partner for the European Health Forum here is WHO Euro, and it's my pleasure to introduce the regional director, Dr. Hans Kluge, a dear friend, and we all know that he is always precise and to the point, and probably will be very good in helping us to understand the need to counterbalancing shock waves and fatigue. The floor is yours, Hans.
Thank you so much, dear Dr. Over, dear Clemens, and dear Commissioner, dear Stella, for a very inspiring opening. And President of the World Health Assembly, Dr. Chris Fern, and my good friend, Minister Rao, and everyone connected. My good friend Dorothy was asking me whether I could pick one of my country missions as an example to illustrate what I am observing when I go to the countries and it's true, I travel a lot. Since Tel Aviv Convention Committee last year, I went to 33 country missions because I believe this is the best way to respond as a WHO Secretariat to the real and changing needs and expectations of the member states and to increase the participatory nature of the member states in our governance. And I thought to tell you the story that I went recently. I was very humbled to be the first region director in history here to go on mission to Greenland, together that time with Dr. Søren Brøstrøm, who was then the Director General of the Danish Health Authority. And I was amazed, really, and very inspired what I saw. And it touches upon the key issues of the health system challenges, but also some of the innovations. The Minister of Health, Mimi Carlsen, then reciprocated my vision, and she came here, my mission, she came to Copenhagen with Dr. Nikke Bertelsen, and she told, the first thing she told is, Dr. Kluge, you were the first foreigner who came to our land in Greenland and gave an award and appreciation to our healthcare workers for the tremendous work they are doing. Which for me, honestly, was very surprising because this was very genuine. But she told we are used and the foreigner comes and criticizes and we are bad for this and we are bad for that. So I think it is a very practical action there, Clemens. When you ask me some practical things, genuine appreciation to our heroes, our healthcare workers. Then I went with the team a couple of hours in the water taxi through the ice to a remote fisher village where we met what I would call one of those unsung primary healthcare heroes named Akka, a lady from the Inuit community, part-time health assistant for the community, 120 fishers, men and women, and part-time even boat mechanic. And through self-made training, empathy, telemedicine, she basically was saving lives. And when I asked her, I said, dear Akka, what is one of the biggest achievements that you see? She was telling one of the biggest achievements was to make the male fisherman cry, meaning that the symptoms of depression, anxiety came out and they were not shy to talk about this. When there were sunny days, she took the people in the village out for a long walk, was educating them on obesity, on preventive medicine, and they accepted her because on one hand, she was not from that community, so people could share their feelings, but she was from the Inuit community, which brings us to the issue of mental health, which I know is very close also to Commissioner Stella, which is something we have to put in attention everywhere. But here, the practical things to learn is trust and empathy and community health workers. At the same time, as harsh as the circumstances were, I saw amazing innovations in telemedicine, including screening ophthalmology for whole Greenland only by telemedicine. Telemedicine in Greenland was literally deciding on life or death. Because when there is a bad weather, which often happens, even the helicopter or the boats cannot go. And you are left alone for hours or days. So there I saw the very practical, life-saving power of digital health, which not always have to be very complicated. The chief nursing officer, who actually was serving as the chief of one of the hospitals, because there was no chief medical doctor, was then kindly taking us out in one evening to the incredible ice caps, which were melting in front of our ice. And she was telling that as a child, these ice caps, which for me was very impressive, were 30, 50 meters even higher, which brings to the point of the climate change. And when I went with Professor Karl Goldbach to our WHO office in Bonn on environment and health, he was explaining about tipping points. At one moment, you get at a tipping point in climate change where land, sea, and air phenomena were giving positive feedback loops to it all, and there is no way back. In other words, we need to find a way of communicating to the people that the climate change is nothing imminent, it's nothing of tomorrow. It's already there. And what people can do really to help building community resilience. It also brings the point, which I know is very close to the heart of Deputy Prime Minister Fern, and actually what Stella was mentioning, of the issue of collaboration. We signed for the first time a transatlantic partnership agreement between my colleague, Regional Director of the Pan American Health Organization, myself, and the Secretary of Health of the US Department for Health and Human Services, because we in the European region are having the bulk of the Arctic region. So whether we speak about climate change or Inuit communities, this transatlantic collaboration getting out of the acute phase of the pandemic to strengthen global health system, but also to work towards attaining health equity is very important. I saw with great admiration that Dr. Fern was discussing some issues with the United States President of America, Excellency Biden, recently in New York, for which Dr. Fern really my heartfelt congratulations. Now, coming to my final point on some issues to do, it's a lot about trust and transforming our health systems, because we are going to have shortage of health workers for a long time. And actually, it's a paradox. We have never had so many health workers in history. So we have much more health workers than before in absolute numbers. At the same time, we have a huge shortage because of the needs which increase. So we need to think of the reconfiguration of our health services, a lot about the primary healthcare system, but not in a dogmatic way. Right? The primary healthcare is the backbone, but as part of the coordination of care. Years ago, when we had the CITES conference in Spain on NCDs and health systems, already we were advocating for what we call regional specialist centers for non-communicable diseases, linked then with tertiary hospitals. So it is one continuum, but it's just the fact that many ICUs are overloaded in our region with patients of which 80% plus could be managed, safe and effective by a general practitioner like I am and I started in Belgium. But for this, the prestige of the GP has to be high. And as a GP, you need to have the tools to manage the patients and have the credibility of the community. And ultimately to move from solo practices to multidisciplinary teams with medicines on the shelf that people can afford. Because universal health coverage in our region is not an issue of access to healthcare. There are issues, particularly for vulnerable groups. I'm well aware, also for some countries, even in the EU, now on LGBT and other risk groups, which is worrying. But it's particularly an issue of out-of-pocket spending, that people can no longer afford to pay for their innovative, expensive medicines. And it shouldn't be that a mother alone with children has to choose between paying for good education and school books or the medicine which is not affordable for a rare disease. My colleagues, we are going to go a little bit in detail 12th and 13th December in Tallinn, Estonia, when we're going to commemorate the 15th anniversary of the Tallinn Charter. I want to also give a lot of appreciation and credit to one of our main intellectual co-organizers, Professor Martin McKee, who I believe is also with you in the room. Thank you very much, Martin. Thank you very much, everyone, and open for any questions.
Hello, my name's Teresa, and I'm a member of the EHFG team, and it's time we did an energizer. So, if you're able, please stand up. Okay. Okay. Everybody float their right hand up into the air and back down. Okay, float your left hand up into the air and back down. Very good, very good. Okay. Both hands together, up and back down. Okay, imagine your hands are paintbrushes. Paint up the wall. Lovely, and paint down. Now pick a beautiful sea blue and paint up and down. Okay, we're going to create our own EHFG shockwave with this move. We're going to start at the front row and it's going to travel all the way to the back. We only get one go of this, guys, so are we ready? Yeah? Okay, and up, front row. Bravo! Okay. Thank you for participating. I'd now like to invite Anya Sitaram onto the stage to continue with the rest of the plenary.
Teresa. Hello, everyone. Are you ready? Are you feeling energized? Can you switch my microphone on, please? Can you hear me now? Yes, I think you can. Right. I hope your fatigue in the room has been counted. We're now going to have our first plenary of the conference. We have 30 minutes to hear insights from a very distinguished lineup of speakers. My name is Anya Sitaram. I am a former BBC World News presenter. I'm now a documentary producer, and I moderate conferences like this. I'd also like to introduce, and I'm delighted to introduce, a renowned public health expert, Professor Martin McKee, who's going to be monitoring your comments on Slido. And just a bit of housekeeping. If you're watching online, you can see Slido next to the stream. If you're in this room, go to slido.com and look for enter hashtag globe. And also we have beavering away here our expert team, Floris Auchon and also Alexander Brenner, who are going to skillfully synthesize the conversation, and we will come to that later. Anyway, let's get on with it. I'd like to introduce our panelists, if they'd please come up to the stage as well. So Chris Fern, Deputy Prime Minister and Minister for Health, Malta, please welcome. Sandra Galina, Director General, European Commission, DG for Health and Food Safety, welcome. Ran Balisser, Chief Innovation Officer, Xialit and Public Health Professor, Ben Gurion University from Israel. Ilona Kickbush, Founding Director and Chair of the Global Health Center, Graduate Institute for International and Development Studies, Geneva. And also, welcome to you. And also Antanas Montvila, Vice President, European Junior Doctors Association. Welcome. So panelists, this is a message for you. We have 30 minutes, not an hour. So this is going to be somewhat compressed. So the questions you get may not be what you were expecting. So Antanas, I'd like to start with you. You're the Vice President of the European Junior Doctors Association. I'd like to hear a little bit about life on the ground. So tell us about your experience and those of your colleagues working on the front lines around Europe.
So, hello, everyone. First, thanks a lot for inviting medical professionals that actually serve on the front line to be present. So we really appreciate that. And I think, if I would really need to be really concise with my answer, there are three words that we already heard, that's how we feel, underprepared, understaffed, and underfunded. But, and it just can easily be explained, like recently from the personal experience. I work as a radiologist, so during the night shifts, when the COVID started until now, our night shift caseload increased double, like increased two times, but we have the same people working, and we're reporting like, I would say we're working on fumes, and basically we just only expect and we appreciate that the system is not safe either for us and our patients. So after the shift, we expect that no fatal mistakes have been made and you will not receive a call. But I think these kind of problems, similar like working 60, 70, 80 hours a week is like very common. And we, together with our European colleagues, we quickly learned that these problems are very similar across the board. So we did a quite extensive study and that we called From Tradition to Transition, Navigating Through Medical Workforce Crisis, that will be released next month. So we kind of interviewed 25 member organizations, and what we learned, there were some facts that we expected, like people feel like heavily dissatisfied with their work. Also, there are like extensive workload that they can't work with. However, there were some really concerning and consisting across geography issues that kind of we now feel that has to be addressed slightly different. First is the massive resignation of profession overall. We're not talking about only kind of moving to to private practice, but people tend to leave profession and just go to work in other fields. Also, there is a great need and call for more flexibility at work, which is also contributes much to that. As well, we feel that medical professionals tend to choose professions that are more easy the professions that lets you to easier have your personal life and ensure better work-life balance. And I'm not talking here even the cultural problems or gender equalities and all these other issues that we hear about. So this is kind of the major trends and what the overall European doctors are facing now.
Thank you. So loud and clear there that actually the healthcare may not be safe, which is also very concerning. And also a call there for flexibility. Perhaps that might actually entice more people to stay. Ilona Kickbush, I'd like to ask you, we heard the workforce shortages, the burnout, the fatigue there, but you've also written about this. What other factors do you think are at play here?
Well, I think we have to be very, very clear. Health systems are in crises because our societies are in crises. And of course, and this is what is really hitting the tipping point, is that so many societal crises, as they reflect themselves in people who then go to health systems, that the crisis is in the system. You can say, if you want to be extreme, you start to become the garbage can for societal problems that are not addressed. And if I were a young doctor or a young nurse, I would be fed up. If I were in the emergency department and I see the poor people coming in and my society doesn't act on poverty or solidarity, if I am a GP and I see that 60–70% of my patients are overweight or obese, and all the problems that flow from that, and I'm in a society that does nothing, but absolutely nothing, against the commercial determinants of health, against food industry, against alcohol, or whatever. And if I'm in a society that allows such a hierarchical health system to exist, a system that functions like in the 19th century, somewhere up there is the surgeon, and somewhere down there is the GP, and somewhere down there is the nurse or the community health worker. And a system like that cannot continue to exist in the 21st century because other parts of society have had to reorganize themselves. They have had to face the fact that we are different now, our challenges are different. And I think unless we address those deep issues in our society unless our health policy becomes focused on health promotion, on prevention, on trying to address problems in a different way. The last point I'd like to make is we've heard about doctors striking, and I wish more doctors would strike, and I wish they would strike together with the nurses, and they would be out there saying our system is broken. We together want a different system, but we also want it together with the patients. And you know, if I were a patient or if I were a mother with a child with a mental health issue, 2 weeks ago in Switzerland, the richest countries in the world, there was a major demonstration of people saying we cannot afford our everyday life anymore, and we cannot afford the high contributions to the health insurance. And these people pay 10% and more of their income to the health insurance, but my son with a mental health problem has to wait for 6 months until he will even be seen by somebody. And unless we bring those things together along the lines that also Clemens Auer has said, we are going to face a tremendous problem also of trust in our societies and of people in the system, outside of the system, and people who are supposed to benefit from the system to say, we will not take this anymore. Thank you.
Thank you very much, Ilona Kickbush. Chris Fern, as Deputy Prime Minister and also Health Minister, what do you think of the OECD and also Antanas said underprepared, understaffed, and suffering from underinvestment as analysis, plus Ilona's suggestion that we need to do more health promotion and perhaps doctors and nurses should strike together? I don't know what you think of that, but over to you.
Actually, Ilona, I'm a surgeon, so you have to be careful. But I take your point. Can I just put this a bit into perspective? Because we are, certainly in Europe, and possibly in the world, living through the best health as a population that we have ever had. If you look at the history of humankind, the humans today, in general, enjoyed the best health they have ever had. So that we have to put that into perspective. Having said that, we could have done and we could possibly do so much more. Because the systems that we have in place and that we have inherited and that we have built on are not necessarily the best systems to get the best results. And change is difficult. A lot of us would prefer to go with the flow rather than change. But yes, we could have had so much more. The problem now is not just that we can have so much more, is that we are struggling, or we will struggle, to maintain what we already have. Unfortunately, after the 7 years of bounty, we are now starting economically, and as a society, the 7 years of drought or the 7 years of famine. And this is because, paradoxically, after COVID, and after the Russian invasion of Ukraine with the resultant high inflation that has brought about, the European Union, and this is now we're talking about Europe, the European Union had in place an emergency mechanism whereby governments were allowed to spend practically as much as they wanted without having to keep their deficit down to 3.5%. Yeah, so the European Union usually does not allow governments to spend beyond the 3.5% deficit in their budget. Otherwise, they get the Commission actually tells you where you have to cut your spending. This exemption is now coming to an end in December of this year. Coupled with that, there is a problem of inflation, the problem of a shrinking economy. So governments have much less to spend, and they have much less leeway with deficits, so they need to cut down. The biggest victim of all this could very well be health, which, and Clemens made the point, leaves a vacuum for private industry to come in. let's make this clear. I have absolutely nothing against the private sector coming into health, and the whole pharmaceutical industry that we depend on is private. So if we want to start talking about whether we should go public, that's one challenge that I put to you, Clemens. Let's look at the pharmaceutical industry, whether there should be some public enterprise with that. So that's another thing. But what the point I need to make, and I'm glad that I don't know whether Stella is still with us, but Sandra certainly is we need to look at this question of whether health spending should be reflected in the national budgets. Because if it is, and at the moment it is, that means next year governments are going to be very, 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 very tight with the spending and investment in health. But if you consider health spending to be an investment, and therefore we can make the case with the rest of the Commission that health spending should not be a reflection on the budget and therefore on the deficit, and therefore governments would be allowed to spend without getting the financial restrictions from the Commission, then maybe we can have better resources, better financial resources coming into health, and we can start addressing the shortages that have been mentioned here already.
Thank you very much. Sandra Gallina, I know that you have to go in a couple of minutes, so I'll keep my question brief and please answer. You heard what the EU potentially should be doing, but what is it doing to help address the challenges?
Well, let me say to you that I will place myself between Ilona and Minister Fern, in the sense that we are doing all we can in terms of legislation. We have just revamped many of the pieces of legislation that concern health. We are doing all we can in terms of financing. And, he was referring rightly so, the minister, to the new strictures of budgetary law, and we will try to see what we can do on that side. No promises, of course, because it's discipline in budget is discipline in budget. On the other hand, let me say to all of you, money and the law is part of the game. The other part of the game is really to behave like Europe. Here it's a real pleasure to have found a community of member states that was ready to work and to do work together in a way that was very innovative, not looking at really the treaty, but looking at the acquis and founding all actions in law, but trying to go and push the envelope as far as it can. So Commission can go as far as member states want, as far as member states allow. Of course, it takes a Commission that proposes, so we are not sitting and waiting for all to be proposed. We are proposing, then sometimes you win, sometimes you lose. You can see from the panoply of issues, EMA fees, the substance of human origin, the revision of the pharma legislation, and the very important European health data spaces. These are 4 of the big building sites, but then I have small minor sites like prevention package for cancer, or I would say even initiatives that concern very limited domains that are more akin to some of you. So what I want to leave as a message to you all, what is it that Europe, because it's also nice to see Commission is always equated with Europe. Europe is all of you, it's all of us. So we are Europe. We can take our future in our hands, and the future is a ticking, I would say, clock in terms of demographics, but also in terms of, I would say, climate, and in terms of sustainability in economic terms. So expecting to turn a big tanker of over 500 million people fast is not fair. We need to work together. We need to give citizens their voice. We will listen to you, but let me say to you, we have the power to arrive where we want, if only we decide where we want to arrive. And where we want to arrive is a future that is sustainable for everybody, where there is no inequity within countries or between member states. I would say even beyond member states, the rest of the world. This is what the Global Health Strategy was aspiring to do. So you have the power to change what may not be working. But let me say to you, the strides that we took under this mandate, under President von der Leyen and Commissioner Kyriakides, to build the foundations of the health union in a different way, in a more inclusive way, I think they are crucial. So we do a lot, but we do a lot only if you actually take the future in your hands. And the ideas I have heard here may be, I would say, food for thought for the next political, I would say, group of commissioners and led by the president, whomever that will be. So thank you, Gastein. Thank you to you all. Always remember, Europe is a good place and we need to protect it the way it was and not let it erode and arrive at a different reality, which is not Europe. This is really crucial. Thank you.
Thank you very much, Sandra Glina. I know you have to dash off, so thank you very much for your intervention. And we heard loud and clear there that the sustainable future is in our hands to some extent. I'd like to bring in a different voice now who's looking from a slightly outside perspective. Ran Balisser, who's Chief Innovation Officer at Clalit in Israel. Ran, just looking from outside, we know that Israel is very advanced in technology and digital solutions. So can you tell us in terms of what innovations there are in terms of digital and AI and how it could help address some of the problems that we've been hearing about today?
Thank you so much. It's always a pleasure to be here. And my view is that actually AI and digital innovation is the only hope that we have as healthcare systems to become sustainable. And the painful truth, I think, that was reiterated here today is that in traditionally operated healthcare systems, there's no way that supply will meet the demand. Even if we ferociously train new providers, as all of us might dream that we might be able to do in a couple of years, that will not be enough. All systems will fail. Some will break down earlier than others. So we acknowledge this fact in Israel, and what we try to do in order to tackle this inevitable future is basically to redesign the system in a way that is driven by the digital data and AI, and I would like to give a few very practical examples to make this more vivid in how this can actually work. So the first example that I'd like to bring is from the primary care arena. So in Israel, primary care is very different than in many other countries. It is heralded as the most important part of the healthcare systems. Primary care physicians get paid more than surgeons. And I think that says something about the priorities of the system and what we think allow us to survive in a cost per capita of 1/3 of many of the other OECD countries and provide the same level of services. It's all about basically primary care. So in Israel now, at Clalit, within the primary care service, when a physician comes in the morning and opens their computer, what they actually see is a prioritized list of patients according to those they need to bring into the clinic proactively to provide them with preventive care, and they are ranked according to the risk of a future problematic event. So we're not waiting for the patient to come in with their pain or ailments. We actually bring them in according to the risk of a future event and where we can be very effective in preventing that future from materializing. So this is not a theoretical construct. This is something that is ongoing and implemented at scale for millions of people that are being cared by Clalit, which is the biggest healthcare provider in Israel.
Can I just jump in there? Is that because you've got the data? Is that because you have the data that you know about this?
This is not only because of the data, because many systems now globally have access to such data. It is more about the ability to utilize this data in a practical daily sense, and as we might talk about a little later, also about the embedded incentives that have to do with preventive medicine. But we might talk about it a little later. The other example that I wanted to give was the problem, for instance, in radiology. Now, this is something that I'm sure many of you share. We don't have enough radiologists to read all of our study images, the study images that we get on a daily basis. So what can you do? So one of the things you can do is to allow an AI system to rank the list of waiting images according to the likelihood of having something meaningful in those images. And then you can have the little time that you have to analyze those data, you can, as your scarce human resource, to use it to tackle just the right patients with the little time that you have. Again, this is not a conceptual theory. This is something that happens. And AI systems now also go over the mammogram studies and say which one the physician has missed something meaningful and help them readjust and fix that. So this is a second example. The third example I'd like to give, all very practical, is from the realm of infectious diseases. Now, we all want to eradicate hepatitis C. This is a mission that WHO has put front and center. The problem is that despite the fact we have a cure that can cure 99% of those patients that get the drugs, 50% of the patients with hepatitis C remain undetected. So when we tried to detect those patients, we did not have the capacity to go to all of them. What we did was create a predictive model, and based on that predictive model, we had a 100-fold capacity to find the right patients at the right time. So we can get so much closer to eradication according to the WHO aims with the little capacity that we have in terms of proactive public health workforce. The final point that I want to make on those examples is something that we've been doing for 15 years, but I think is really critical. It's our ability to have a health information exchange that works continuously. So when a patient goes into the emergency room, he knows their physician that sees them at the emergency room sees all of the data coming out of the primary care clinic at that minute and 5 minutes before that. And when a patient walks into a primary care clinic, the primary care physician can see everything that happened in the ER that he was discharged 5 hours before. So this is critical in preserving resources, maintaining unnecessary tests from being done, and getting better health outcomes. So, well, this all, and I think there's half a dozen other examples we could give and will not give today, but I will just end with a word of caution. Not every digital health innovation is resource sparing or helpful. We have to be very cautious, and we have to take into account that some of the new innovations that are brought to you are counterproductive. They are causing overdiagnosis and over-treatment and focusing on the wrong things just because that's what was available. So I would, one thing that I would consider promoting in every one of the countries is collecting real-world data and doing real-time analysis of the effectiveness and the efficiency of these interventions before, during, and after they are widely implemented, so we can all learn from best practices and invest where we can actually get some more sustainability rather than going the other way around.
Thank you very much. Great to hear such tangible examples. I think quite inspiring, but also the word of caution there as well, which was a bit of a reality check. Martin, come and, do you have a microphone?
I will have.
Yes. Do tell us what's been going on.
Thanks. So we've got a number of questions, but I've tried to distill them into two. And maybe if I give you them both, given that time is short, you can choose what you want to take out of them. A series of questions about private healthcare, one in particular for Ran, which is about whether it's true that 88% of Israelis have private care. I think you'll need to answer that in the coffee break because it will involve a rather more complex discussion about the HMOs and so on, but just to pick that one up. But maybe we could step back and ask ourselves if there is a risk that those of us, and many of us, and there's maybe not all, but many of us in this room, can afford to opt out of national health systems. But if we do, will we begin to start to question whether us, should be paying for them who can't? So is there a risk that the shift to private healthcare by those who can afford it undermines the solidarity that underpins our health systems? And the second set of questions, and I pick up one by Mark Hennessy. Mark Hennessy, hold up your hand, from Dublin, who asked about whether the solution to the problems we face is just a matter of money, or do we need structural reform? Now, Hans has already mentioned the Tallinn conference with Trust and Transformation. But maybe I could just ask the panel if, to remind us that this isn't the first time in Europe that we have had a major outbreak of infectious disease coincide with a labour shortage. Now, nobody in this room will be able to cast their minds back to 1348, but in that year, the Black Death swept across Europe, and it led to all sorts of changes. The peasants' revolts, the agricultural revolution, and some would argue the Reformation because of the loss of faith in the church. Now, I'm not suggesting that the transformations that we need are on that scale, but I'm wondering if the loss of the health workforce, some of which is directly related to the pandemic, pandemic, moral injury, burnout, and so on, long COVID, and also a sort of change in attitudes that has resulted from that. Have we actually captured, are we thinking big enough in terms of the scale of transformation that we really will need? And I'm looking particularly around here with the ideas about AI. So 2 questions. One is, if the middle classes opt out of the system, will that undermine the European social model? And the second question is whether we've got enough of a broad enough vision as to the changes we might expect.
Thank you very much, Martin. And panelists, we've got about 3 minutes in which to answer these. So I'm going to start with Ilona. Just choose whichever one you want to answer, and perhaps 30 to 40 seconds.
Well, I'll take up the first issue, and all you have to do is look to Brazil. Brazil instituted a fantastic public health system, and with family care services, with decentralized GPs, absolutely fantastic. When the investment in that system started to crumble, the middle classes went off into private care. And the result was that that excellent system also crumbled. And the result was, bad health for everyone, including the middle classes, except those that had a real lot of money. But the other side of the picture is, if the public system doesn't offer what people look for, then they will also go out. Because the lack of innovation in a system for people who, get an appointment or a digital solution or whatever in every part of their lives, except in relation to health, will lead for them to look for other solutions, and solutions that I can get quickly. And that's why Amazon is into health, that's why Microsoft is into health, that's why Amazon went to New Zealand and said, guys, we're going to help you reform your public health system. And that's not just negative, because they have developed the creativity to envisage a different kind of ecosystem for health. And we've got to start learning in new ways in the public system to innovate, and maybe that is the biggest challenge of all, to face that challenge. Thank you.
Thank you. Antonas.
I'll try to be really fast and address both. I think regarding the opt-out, we should look to the German example, like when they allowed people to opt out, and then they started going back. So you need to put clear limit. If you're leaving, you will not be able to come back, because we all understand it's easy to opt out when you're young and you don't face with like really expensive diseases, but when you need to pay the bill, likely you will be wanting to coming back, and then puts both public and private systems in big crisis. Coming back to the workforce thing, I think there are only 2 things. There are a lot of things we could think about, but there are 2 things to understand and comprehend. One, we will not have more workforce, so stop dreaming about producing more workforce and investing in like training. Of course we need to invest, but we will not, so we need to reshape the system that reflects the reality, not utopian kind of dreamy workforce that we will have. And also, I think it's also important to understand that social fabric, as I mentioned before, people are silently protesting for this failing system, not going to the street, but they leave the profession at all. They're not even changing the medical specialty, they going to other industries, which also puts big pressure on those who stay. So I think we also need to comprehend with that as well.
Thank you. Ron.
We'll try to be brief. I think when we talk about private versus public, we need to understand the difference between public funded and public provision. While I think that it is completely legit, and even in the current crisis we have, necessary to have private entities be part of the healthcare provision system, it is critical to maintain the funding public. And if the private providers can play by the public rules and then maintain the solidarity and all of the other aspects that are important to all of us, then they're welcome to come in, and actually they enhance what is most important for a successful healthcare system, which is competition. health systems that have a monolithic, with little competition within it, even if it's public, usually tend to be stale and fail at some point. So by adding this bit of competition, this will drive, as Ilona said, innovation into the system, and I think this is very welcomed. But as was mentioned before, if we allow this to become fully private and we erode the basic solidarity and the basis of insurance in which every people need to kind of devote resources and take when they need, then the systems will eventually fail. And this is something every government needs to find a way to tackle, because it's the easy solution in the short term and it's devastating on the long term.
Thank you very much. And final words to you, Chris.
In answer to Martin's questions, it's never a good idea to allow a crisis to drive your change or your innovation. You shouldn't need to wait for a crisis before you change. On the other hand, it's also never a good idea to waste a good crisis. So, because we are having, we've just come out we've just come out of the pandemic, and we're now in the crisis of sustainability or financing, and because now we have problems with health workforce, problems coming on the horizon already here with the climate change, Mars, so many crises happening. Then yes, we need to take advantage of this and use those as agents for change. On the other hand, we also need to look in the medium and in the long term. And that involves having a good think of what we've been doing over the last 50 years or so. Some things have worked, some things have not worked as well as they should have, and we have to have the courage and the vision to be able to change those things that haven't worked.
Thank you very much. Thank you very much to our panelists. Let's just take a look at what Floris has been doing. Are you able to quickly show us on the cartoon, and also then Alexandra, and then I'm going to invite Johannes Rach to make some final comments. So there we are. Thank you very much. And Alexandra. It's even more, gosh. I suppose these will go on the website afterwards, and everyone will be able to look at these at leisure. Thank you very much to our panelists for your very thought-provoking and I think practical comments. Great to have examples of what's actually happening and answering your questions like that. Thank you very much. And also, I'd like to thank our Martin McKee and Floris and Alexandra as well. And I'd now like to invite Minister Johann Rach, Federal Minister of Social Affairs, Healthcare and Consumer Protection from Austria, for some final comments. Thank you.
Thank you very much. I guess another 3 minutes are enough. Questions around social and health investment, fiscal rules and budgetary challenges will be of enormous political importance over the coming months and years. Let me try and give you a short summary, about eight key issues as I see them. First, our budgets at European, national and regional level are going to come under increasing pressure. Reasons for this include the costs of handling COVID-19, the other crises, energy crisis, fight against inflation, and higher interest on debt and new capital. Second, that's why fiscal rules are becoming a battleground for all member states along the issue saving versus investing. Saving almost means cuts. And cuts almost always affect the areas of health and social protection. Third, spending on health and social protection is an investment. We always talk of investments in connection with building roads and buildings, bridges, housing of power plants. But whenever money is spent on health, social matters, or care, these expenses are referred as costs. And that's just wrong. We must change this mindset. Fourth, it's true that that not investing in health, social matters and care save money in the short run, but it will generate a dramatic volume of additional expense within just a few years due to inadequate quality, insufficient services and poverty. And yes, there is economic evidence of these effects. Fifth, investing in health, social matters and care will not endanger the competitiveness of the EU and the member states. On the contrary, it will help to safeguard our competitiveness in future. Sixth, without these investments, it is not only our budgets that will come under pressure, but also democracy and the rule of law, as the anger of those left behind will make itself felt, not least on our streets. Seventh, as far as Austria is concerned, I have agreed with my colleague, good colleague, the Minister of Finance, that we will indeed spend more money in health, social matters and care, but only if reforms are part of the deal. We need better targeting, more efficiency, better quality, a more proactive approach and less fixing of what's broken, and more digitalization. And last and eighth, you've all heard the saying, it's the economy, stupid. In the future, we'll be saying, it's social and health protection, stupid. Thank you.
Thank you very much. I think there's a tea break now, and then there'll be another session here afterwards in about an hour or 4:15. I'm probably giving you the wrong information, but thank you very much, everyone.